Hello everybody. Today we are going to learn about pneumonia. What is pneumonia? Pneumonia is an infection of lungs. It can affect one lung or both lungs that causes inflammation of the alveoli. It's an infection of the lungs that causes inflammation of the alveoli. What is alveoli? When you look at the respiratory tract, air enters through the nose, passes through nasal cavity, throat, which is also called pharynx, then comes larynx and trachea. Trachea divides into bronchi at the point called carina, and from the bronchi, lower respiratory tract begins. Bronchi enters the lungs. Bronchi divides into secondary, tertiary bronchi, and then into bronchioles, and finally the alveoli. So alveoli is a tiny balloon-shaped air sacs which is surrounded by capillary network. It inflates and deflates during respiration and helps in gas exchange. That is, it removes carbon dioxide from the deoxygenated blood and provides oxygen to the blood. So what happens when there is infection and inflammation of the alveoli? This is the normal alveoli, and when there is pneumonia, the alveoli gets filled with fluid. This fluid is consisting of bacteria, body's defense mechanism, WBCs, and then RBCs. As it gets filled with fluid, this alveoli loses its ability to inflate and deflates and impairs gas exchange. As a result, oxygen level in the body decreases. That is called hypoxemia, and carbon dioxide increases. And in the ABG, you will see the partial pressure, PCO2, increases. As a result, pH decreases. And this is known as respiratory acidosis. Patient may develop respiratory acidosis. What causes pneumonia? Pneumonia is caused by bacteria, virus, and fungi. The most common cause of bacterial pneumonia is Streptococcus. Next is atypical pneumonia. This pneumonia is caused by Mycoplasma pneumonia. This is also called walking pneumonia because symptoms are mild, does not require hospitalization or bed rest. Virus that cause cold, flu, COVID-19 can also lead to pneumonia. Pneumonia caused by fungi are seen in people who are immunocompromised. What are the types of pneumonia? Pneumonia are usually categorized into community-acquired pneumonia. This pneumonia develops in the community outside the hospital. This is the most common type of pneumonia. Next is hospital-acquired pneumonia. This pneumonia develops when a patient during hospital stay, usually after 48 to 72 hours after hospitalization. This is usually difficult to treat because the patients are already sick, and the bacteria that causes this pneumonia may be resistant to some antibiotic, which may cause longer duration of treatment and need stronger antibiotics. Third is aspiration pneumonia. This pneumonia is due to the aspiration of food, GI contents, vomit, or saliva into lungs. Now let's see the high-risk group for pneumonia. Children 2 years old or younger, elderly 65 or older, people with chronic lung disease, example asthma, COPD, hospitalized patient, weakened immune system, smoking, which damages body's natural defense mechanism against bacteria and virus that causes pneumonia. How is pneumonia diagnosed? With chest x-ray. Chest x-ray you may see infiltrates in the lungs, sputum culture and sensitivity, which helps to identify the organism and treat accordingly. In the ABG, you may see respiratory acidosis and abnormal breath sound. Sometimes physician may order CT scan of the chest for better visualization. What are the signs and symptoms of pneumonia? It's an infection of the lung. The patient may present with fever, cough, which may be productive, that means with sputum or maybe without sputum. Chest pain may be associated with breathing or cough. Patient may feel difficulty in breathing. General signs and symptoms include decreased appetite, nausea, vomiting, nasal congestion, headache, fatigue, fever, confusion, which is usually seen in elderly patients. How is pneumonia treated? Bacterial pneumonia is usually treated by antibiotics. The antibiotics can be broad spectrum or narrow spectrum. Narrow spectrum antibiotic example are macrolides, example C-Pack, Citromax, penicillin, example penicillin G. Now the broad spectrum antibiotics are cephalosporins, third and fourth broad spectrum, tetracycline, example doxycycline. Then comes vancomycin, which is used to treat severe cases. And finally, fluoroquinolones, example levaquin. This is also used to treat severe cases. Along with antibiotics, if the patient is flu positive, then Tamiflu administration, cough medicine, fever and pain relievers, adequate hydration. In hospitalized patient, if hypoxic, oxygen administration, and in severe case, may even require mechanical ventilation. Thank you for listening to my video.